Hello everybody, this is Dr. Reyes-Fournier coming to you live from Miami. I'm doing a recap for week 3, specifically going over the discussion that you all did. And we're going to start with talking about a structured, unstructured, and semi-structured assessment. There seemed to be a bit of confusion that some of you were writing about structured, unstructured, and semi-structured interviews. An assessment is not an interview. Yes, an unstructured assessment is basically an interview, but when we're talking about assessments, we're talking about measurements that we use and that have been clinically proven to be effective tools to measure whatever we're looking to measure. Assessments you can call it, like for example, you could use an IQ assessment to assess IQ. You could do an assessment to assess how depressed somebody is, like the Beck's Depression Inventory. Right now we are talking about the assessments that we use to screen and to measure the level of addiction in an individual. Structured assessment specifically is used, and let me just go to something. This is an article, Assessing Addiction Concepts and Instruments, that I will be sharing with you. A fully structured assessment, which is basically what we have back here, the ones that I did not highlight in green, for example, the ASI, the AUI, MST, MCMI, MMPI, PAI, the SASI 3 and the SASI 2A, which is for adolescents. Those are structured assessments. Those assessments are either done by you reading a question and the client answering the question, yes or no, true or false, or you hand them the assessment and they actually fill it out themselves. More likely than not, within a facility, this would be something that we would have not a therapist do. In other words, I can have anybody from the staff watch them while they do these kinds of assessments. If I'm going to be reading questions, I would prefer to do that. However, because you're not allowed to deviate at all in a structured assessment, once I train somebody to do this, they could do that, whoever it is, whether it's like, line staff, behavioral techs, interns, somebody that has more training than just, off the street kind of a person. You would have to, tell them, no, you're not allowed to explain anything. There are rules to this, but we like using these because it takes less time out of the more professional people. Like, if you have a higher degree, you are considered professionals, and the lay people who do not have degrees. And that way you could spend your time doing counseling and writing your notes and creating treatment plans while somebody else is gathering information for you. That doesn't mean that you don't get to do anything with this information. You get to get it and, calculate the results, and then you use those to create your plans and write up your reports. A semi-structured one is where we have open-ended questions, and some of those are, unfortunately we don't really have any of these there, but things like the ASAM. The ASAM is a semi-structured assessment that we use specifically to create a biopsychosocial. A biopsychosocial is a complete history of the client. When I say complete, I mean complete. There are questions in a biopsychosocial like the ASAM from, how did you do in kindergarten to, that's not really a question, I'm kidding. But, what year of school did you finish, to were you a vaginal birth or a C-section? Did your mother have any problems? Did your mother use drugs or alcohol during the gestation of your birth, when you were in her womb? These are all questions that we ask because they're all pertinent. That question is going to give me an idea of whether they were born addicted or that they've had these issues for a long time. A biopsychosocial is something that you write up and you stick in the client's file. That way they know that anybody who picks up the file knows the complete history of the client. And of course, an unstructured one is basically an interview. And those are usually done like after you've gathered this information, you've done your biopsychosocial, you have the results of the structured assessments, then you could ask more probing questions to certain things that you found odd. And I will go over some of the things, specifically the assessments. The ones that I have highlighted here in green, like the audit, the cage, the TACE, and the tweak, are considered screening tools. Screening tools are used specifically before a client is admitted formally into a program. We want to know using these tools. Now, the audit is specifically only used with pregnant mothers, pregnant women, to rule out whether or not they've used drugs or alcohol during their pregnancy. Everything else, like the cage, the TACE, and the tweak, many of you went over the cage. 4 simple questions. If you say yes to 2 of the questions, have you ever tried to cut down? Have you ever been annoyed? Do you ever feel guilty? Blah, blah, blah. If you answer 2 of these yes, then you are considered to probably have a problem with drugs and or alcohol. TACE and tweak, basically the same structure of that. Now, the other ones you see here, like the ASI, AUI, MST, MMPI, are full paper pencil assessments. Paper pencil assessments are usually longer, at least in this case, probably between 40 to almost 600 questions, if you look at all of these different ones. For example, the MMPI. The MMPI is actually on its third or fourth iteration now. It's the MMPI 2RF, no relation to me. RF means restructured format. That's not what my name stands for, just so you know. But the MMPI has 567 questions, which are all true or false. Things like, I like gardening, and things like that. Those are some of the questions from the MMPI. But also things like, I often feel jealous. These are MMPI questions. There's 567 of them. There is no time limit. It is basically this big old thing that you hand the client with a pencil and they fill it out. Very rarely do you have somebody reading questions, and that's only done in situations where there's a reading difficulty. But the questions are structured in such a way that they aren't, that you don't require a very high reading level to comprehend them. This is probably the most studied assessment in the world at this time. It has been standardized, validated. It has been compared to pretty much everything under the sun. It is an exceptional assessment tool. The problem is, because it's an exceptional assessment tool, it's also really expensive. And the way that you score these things, because there's 567 questions of it, it's usually easier to score it with a computer, and you have them do it computer-based and stuff like that, which is a big cost to a facility. Therefore, MMPIs are rarely used. They're used in big hospitals where, they get a deal from the MMPI people. Many of you mentioned the PAI, and I'm going to quickly go over the PAI. The Personality Assessment Inventory takes about an hour to take. It has tons of questions as well. Also true and false, exactly like the MMPI. is set up. This assessment has 22 scales, and they're non-overlapping, which is an important thing to people who do research. And these are the scales, and you will see that alcohol problems and drug problems are part of it, but you're also measuring things like somatic complaints, anxiety, depression, mania, paranoia, schizophrenia. So it is actually measuring not just personality, it's actually measuring psychopathology. One of you put psychopathy, but that's completely different. Psychopathy is, something that we do with like serial killers, and we try to figure out the level of psychopathy that they have. Psychopathology is mental illness, mental disorders, and the such. And the PAI helps us diagnose. Now, to be clear, the PAI has 12 questions out of all their questions. I don't remember how many questions they have, but they have 12 questions on drug problems. That is not a lot. Alcohol problems, I think that it's similar, a little bit more actually. They also can rate the severity of the drug problem based on their results also from the other areas. The good part about the PAI is the fact that when you get this, you will see that you will actually have a score as to whether or not they might have a drug problem or an alcohol problem, but you will also see if there's any other co-occurring mental disorder as well, which is something that we need to know when we are doing our treatment planning and when we get to know the clients. I'm also going to show you, I'm also going to provide you with this lovely article, which is about screening and assessments. That comes from what? It comes from SAMHSA. Remember I told you about SAMHSA and that you could order these books. This is a chapter straight out of a SAMHSA book that you can get, and you can have them send it to your home, and I will give you the link to that. I think that should do it.